coming out to today's press conference and granting meet and greet. I know it's a little bit warm in here. As soon as the press conference portion is over, we're going to turn the fans back on. So hang in there. There are refreshments, drinks, and snacks back there, so please help yourself. My name is Jen Teachi, and I'm the Executive Director of the Illinois Disciples Foundation. And also, before we get started, if I could ask everyone to either put your cell phone on vibrate or silence, that would be greatly appreciated. First, I would like to thank Wesley Evening Food Pantry, one of our grant recipients, and the Wesley Foundation for generously donating this room for today's event. We're hosting the event here in this very room because this is where Wesley Evening Food Pantry meets once a month, and they serve up to 1,400 people in an evening. Behind me, you can see a selection of the food that is offered at the food pantry. And this is normally here during their food pantry nights. So that way people can see what food is available and they can choose what food they want to get. And this is a key element in Wesley Evening Food Pantry that makes what they do not just a service in the community, but an act of social justice. Because it's very rare that people can actually pick the food that they want when they're getting emergency access to food. Today we are here to announce and recognize the 14 grant recipient organizations of the IDF Social Justice Grant, which received a total of $189,000 in 2010. We, the IDF, are very fortunate to be able to offer this grant for a second year. The IDF has been able to distribute over $400,000 to our community in the last 2 years through various grant programs. While the recession may have ended over 14 months ago, as you may have heard on the news this week, individuals and organizations alike, I think, have continued to suffer hardships since then. And at a time where many grant-giving organizations of all sizes have had to cut back or even eliminate grants and other funding, and at a time where state funding has either been late or cut back altogether, we've had a rather unique opportunity to be able to put money back into the community, where we've been based for over 100 years. So we're very fortunate to be able to do this. Our mission is informed by our legacy of campus ministry, direct action for social change, and the radical traditions of the disciples of Christ. The IDF continues our activist legacy by supporting efforts to further the struggles for systemic change to attain social justice. And I wholeheartedly believe, actually I know, that the IDF Social Justice Grant Program is a strong step in fulfilling our mission in helping Champaign County. For example, in 2009, IDF Social Justice Grants allowed Crisis Nursery to provide for 720 hours of crisis care to 30 children. It helped Smile Healthy to provide free dental services to adults through a mobile dental health clinic. It enabled the Farmers Market on North First Street in Champaign to accept link payments, making the fresh produce available to a wider variety of the community. And it helped further Wesley Evening Food Pantry's capacity to provide emergency food services to over 11,000 clients last year. And this is just what 4 of last year's 20 recipients have accomplished. All of the grant recipients this year are based in Champaign County and serve the local community through direct social service and social justice work. They serve the underrepresented and more often unrepresented citizens of our community. And they are doing this in a juxtaposition of funding cuts, but an increased need for services. And I'm very proud to announce this year's grant recipients, the second class of the IDF Social Justice Grant. And as I read the following organizations, with representatives from those organizations, raise your hand so we can see who's here. Avicenna Community Health Center, Champaign County Christian Health Center, Champaign-Urbana Tenant Union, Channing Murray Foundation and the Red Herring Vegetarian Restaurant, Church of the Brethren's Motherlands Culture Club, Crisis Nursery, Generations of Hope, Greater Community AIDS Project, Rape Advocacy, Counseling and Education Services, Smile Healthy, the Urbana-Champaign Independent Media Center's Books to Prisoners, the University YMCA, Wesley Evening Food Pantry, and the YWCA of the University of Illinois. At today's press conference, we will have a chance to hear from representatives of 5 of these organizations, followed by comments from State Representative Naomi Jacobson. Our first speaker is from the Wesley Evening Food Pantry. Donna Camp is the director here at the pantry, starting the pantry with 2 others in the fall of 2006. She also works as a coordinator of research programs at the Center for Prevention Research and Development at the University of Illinois. I would personally like to thank her for her assistance in making today's event possible. You've done a lot to really help with this event. So please welcome Donna Camp.
Good morning. Welcome to Wesley. This seems like a small group here to me today because once a month we have several hundred people here. And in fact, it's often standing room only at 5:30 on the third evening of the month, third Thursday of the month. Jen has already given you some of the numbers that I was going to start off with, so I'm going to skip a little, and if I get confusing, that's just the way it goes. 2009 was a year of huge surprises for the Wesley Evening Food Pantry. The previous year, we had served about 5,000 people on our monthly food pantry. In 2009, that number jumped to over 11,000. As we were in the midst of how do you deal with that logistically, financially, the opportunity to apply to the Illinois Disciple Foundation Social Justice Grant came, and it really turned the corner for us. For the first time, we were able to hire staff, to pay for some of the enormous food bills that were coming in that our fundraising had not yet caught up to, and to have the time and space to develop a plan for how we would sustain this program in the future. I'm happy to say that we have been able to do that. Our numbers for 2010 are looking almost exactly the same as the numbers for 2009. So as far as we're concerned, the recession is not over. However, because of the grant that we received last year and knowing that the grant is available this year, we have a plan that we have implemented for fundraising. And so the donations we have for food are keeping right in line with the amount that we're spending. We have been able to hire a volunteer coordinator so that the 100 to 200 volunteers that we need on the week of the pantry are not as overwhelming as they were a year ago. And so the ability to serve 800 to 1,200 people in 2.5 hours every evening of the third Thursday of the month is, it's no longer a scary prospect. I know there's going to be food. We have never run out of food, and I think that's due in large part to the fact that we know that this grant is available and that we have a reserve, so that when the storeroom is empty, I order whatever Eastern Illinois Food Bank may have, and you can see the example. Having the grant has also enabled us to leverage some other resources. For example, we're going to be able to give a stipend to U of I's social work interns. We're one of the few places that does offer a stipend to interns. Makes us a pretty attractive place for people to come work. And even through this meet and greet and the meet and greet last year, we've made connections with other organizations. One of the things that we do that we think is pretty important is that while people are waiting for their turn to get food, they have a chance to sit in this room, and various community organizations rotate through here to be able to provide information and referral services to people. We sort of guess that if people are at a place where they actually have come to a place that they need to ask for food, they probably have some other needs. So we've been able to connect them with other resources in the community. And so for those of you who maybe haven't been invited to be here at this point, Judith is here, and I'm sure she'd love to talk to you about getting you into the rotation of services. In addition to the things that the money has helped us be able to do to sustain our program, for me, it's been almost as important to have the support of Illinois Disciples Foundation and all of you to reaffirm our own commitments to social and economic justice. In the day-to-day life of my work, of how are we going to get enough volunteers, oh my goodness, the electricity isn't working today and it's hot up here, those things like that. It's really easy to forget that the reason that we're really here is to work for the hope that there will never need to be a food pantry. And having a time like this where I don't think that I'll need to argue with anyone, but instead that you all are the kind of people that would agree with me that in in order to let people choose their own food, or that we don't want people who are coming for food to have to wait outside, but instead be able to sit in this room and talk to each other and talk to other people in the community, that's a worthwhile thing to do. And for me at least, that's part of what makes this an occasionally fun job to do. So thank you, Illinois Disciples Foundation, for your monetary support and your spiritual support to keep us in the world.
Thank you very much, Donna. Our next speaker is Carrie Funk from Rape Advocacy, Counseling, and Education Services, also known as RACES. Carrie is the Executive Director at RACES, and prior to becoming the Director, she was a volunteer on the Rape Crisis Hotline and a staff advocate. Carrie and her family moved to Urbana 4 years ago and have since decided to stay permanently, which I think is a great thing for sexual assault rights in our community. And having personally volunteered at RACE's predecessor, Rape Crisis Services, I am especially grateful to have RACE's involvement in the grant cycle. So please welcome Carrie Funk.
Thank you for including us in this. We're very excited for these funds. We're a fairly new organization. We just completed our first fiscal year. In 2009, we became a standalone agency that focuses just on survivors of sexual assault and abuse and their non-offending significant others, which has allowed us to concentrate our focus on our core services. We operate a 24-hour crisis hotline, provide medical and legal advocacy, and have ongoing services such as counseling and help with the criminal justice system. We applied for this. We have a very activist-based and volunteer-based organization. We rely heavily on volunteers to staff our 24-hour crisis hotline, as well as to provide our child assault prevention education program, which focuses on pre-kindergarten through 5th grade. We have to provide all of our volunteers with 40 hours of crisis intervention training before they can ever set foot in the schools or pick up the hotline. And so this will help us offset those costs because our volunteers are so very, very important to us. Along with that, we are very excited because a lot of foundations and funders in the community don't like to help pay for logistical things like pamphlets and pens to give to people so that they have our crisis information with them wherever they are. So this is something that in our community outreach efforts is immensely helpful because of those little logistical things. So I would like to thank the Illinois Disciples Foundation for including us and for everybody for supporting us. Thank you.
Thank you very much, Carrie. Our third speaker is Stephanie McCord from Crisis Nursery. Stephanie has just completed her second year as the Executive Director of Crisis Nursery. Her experience in education, juvenile justice, and child welfare complements the needs of the children and their families in crisis situations. Her professional experience includes staff training, supervision, evaluation, developing budgets, monitoring programs, and grant writing, which obviously she is doing a very good job to be here today. She has a master's in education from the University of Illinois Educational Organization and Leadership Department, as well as a master's in social work. And in 2009, she was named 40 Under 40 Central Illinois Business Award winner. So please welcome Stephanie.
Thanks, everybody. I just wanted to, again, thank the Illinois Disciples Foundation for giving us the opportunity to talk to you today about where these dollars are going to help families and children in our community. For those of you who aren't familiar with Crisis Nursery, we're an emergency shelter placement for children whose families are in crisis. So we are available to children and their families 24 hours a day, 365 days a year, and our primary goal is really to prevent child abuse and neglect. So we really want families to come to us in advance before they really are feeling that stress where they can cause harm to their children. So we're there on the front end of things before a situation hopefully leads to child abuse or neglect. And we're the only agency of this kind in Champaign County. I just want to tell you a little bit about the past 2 years. I know a lot of the agencies in our community have sustained a lot of different cuts from different funding sources, and we're no different. We've had about $85,000 in cuts from local and state funding sources during the past couple of years. And so we've looked for additional funding to help fill the gaps and to support our budget. And the timing of this grant was perfect for us. Instead of having to cut services to families, we were able to maintain our services, and this allows us to keep our doors open to families in the community and not have to cut staff. So this really came at a critical time for us. Even though I know we talked about the recession hasn't ended and families in our community continue to need our services even more. So, we're always trying to find creative ways to help support the budget, and this is just another great way to do that. I think, again, like other agencies in our community, we're still waiting for state funding that's been promised to us to come through. We have about $34,000 from last fiscal year that is still owed to us, and we're making ends meet with the dollars that we have, but we're waiting on things that were promised to us last year. So we're hopeful that those dollars will come through, and that the money that we're supposed to receive for this year will be there as well. And again, we're not unique in that respect, but it is something that all of the local agencies and organizations are dealing with right now. And so this is just a great way with Illinois Disciples Foundation kind of stepping in and helping support our organizations that we're able to meet the needs of our community and not having to cut services. The crisis care program at the nursery serves children whose families have no other resources. So if they're in crisis for a variety of reasons, parental stress, illness, accidents, homelessness, we're there to help. And those are just a few of the reasons that families come to us. We don't define what a crisis is for a family. Every family is different, and a crisis hits a family differently. And so the family defines the crisis, and we're there to help support them. We're available for the entire community to access with no fees, income eligibility, or waiting list. And that's something that we're proud to say we've been able to maintain. We haven't had to charge fees for our services, and that makes a big difference to these families as well. And then we also provide family support and parenting education to help strengthen the skills and confidence of our parents. I think a lot of times people in the community think that the families we serve aren't trying to do better, aren't trying to work, aren't trying to take care of their families, and that's so not the case. I mean, our families are working, they're just not able to make ends meet. And so to really be able to help support them and strengthen them when they're already doing a good job as it is, and just helping build those supports around them, that's what we want to do. A lot of these families are in these situations not due to any fault of their own, just because of circumstances. So we are really thrilled to have found out that this year the Illinois Disciples Foundation will be providing us $45,000. This is a huge increase from last year, so we're going to be able to provide 7,200 hours of crisis care instead of 720 to 300 children instead of just 30. So this really did bridge that gap and that funding cut that we had last year and enabled us to continue serving children. So I just want to thank the Illinois Disciples Foundation again for allowing us to apply for this money and for awarding it to us. And I can assure you that every penny that the funding of that funding will go toward providing an island of safety for children in our community. Thanks.
Thank you very much, Stephanie. Next, I have the pleasure of introducing two leaders of Avicenna Community Health Center, one of our newer grant recipients. Dr. Irfan Ahmad serves as the president and CEO on the board of directors at Avicenna. He holds a PhD in agricultural engineering from the University of Illinois and serves as the associate director at the Center for Nanoscale Science and Technology and research faculty in the Department of Agricultural and Biological Engineering at the University of Illinois. And that's a very long title to say. He has also served as the president of the board of directors at the Central Illinois Mosque and Islamic Center Association. Also, Dr. Sadiq is the medical director at Avicenna Community Health Center, as well as a volunteer physician there. She is also a physician at Decatur Memorial Hospital, specializing as a hospitalist. She is also an author and a community activist working on a number of national and international issues. And it is my pleasure to introduce both of them from Avicenna Community Health Center.
Jen and the Illinois Disciples Foundation for giving us this chance to avail this grant, and I would like to acknowledge my colleague here, Dr. Shamim Sadek, with me, who's been on the front line of providing this healthcare services. Since we are a new entity, I would take this time to just give you a little bit of a brief about the Avicenna Community Health Center. This was a desire stemming from a desire that we had to address the healthcare needs of residents of Champaign County and to embody the spirit of activism in Islam. This Avicenna Community Health Center was conceived a long time ago, but was initiated formally in May 2009 in the community by the local Muslim community, and is now incorporated in the state of Illinois and is also as a 501c3 nonprofit organization. Avicenna we see as an interfaith academia community partnership which undertakes to work collaboratively with other area clinics and is also leading the efforts toward the deployment of electronic healthcare medical systems. Avicenna's strength comes from the strong pool of volunteer physicians, and these are primarily internal medicine physicians, which is again a scarce commodity, as we know from the healthcare reform bills and the like. So that, and with their extensive medical experience, that is an added asset to the community. Avicenna itself, sometimes recognized where the name Avicenna came, is a Latinized name for the astronomer, mathematician, physicist and physician Ibn Sina, a 10th century scholar and a physician. He is considered a father of modern medicine for the discovery of contagious diseases and the introduction of the concept of quarantine and spread of diseases. So our goal here is to model some of the work that he has done and embody that spirit, and to recognize his excellence in medicine and promote a healthcare lifestyle, healthy care lifestyle in our community, providing culturally competent care to the uninsured residents of Champaign County. The grant from Illinois Disciple Foundation has facilitated the hiring of a part-time assistant coordinator for clinic operations and administration, which has enabled us to provide continuity of patient care during the week, since we operate only during the weekends. This in turn has accorded opportunities to train the next generation workforce, which is much more attuned to the needs of the communities that they live in, and then practice compassionate care. When a patient comes in and tells us that she is so glad that we are here and that she likes the care and compassion and attention she gets from Avicenna and is not treated as a number, or when a woman in her feedback form to us tells us that on seeing the flyer, Avicenna Medical Clinic now open for uninsured residents of Champaign County at her neighborhood laundromat, tears flowed from her eyes as she had been sick and did not have health insurance. The free clinic, she characterized it as a God-given opportunity, God-sent opportunity, and expressed her gratitude to Avicenna for enabling her to commence her treatment. We believe we are making a difference, one patient at a time. These stories, my friends, are a vivid illustration of how Avicenna Community Health Center is attempting to empower individuals who are near poverty and face the daily hardship of choosing between medicine and food, to take charge of their health care in a comfortable, nurturing environment. The mission of Avicenna Community Health Center is to work in the area of social justice by providing culturally competent health care to uninsured residents of Champaign County, by conducting preventive health screening, and to promote awareness through education and information dissemination, which is a key part. Due to our limited resources, currently we are only providing services to 18 and above, but we are focusing on medical conditions which are quite common, including hypertension, diabetes, obesity, and primary care. And we would like to add other care like the dental, mental, and ophthalmological health to our services. However, due to constrained resources, we are taking one step at a time. Our goal is to serve 1,000 patients during our first year of our operation by offering services over the weekend, which is about 4 to 8 hours per weekend. During our initial launch period, we have provided services to about 15 to 18 patients per weekend. We would like to thank IDF for making grants available to us. We would also like to specifically acknowledge the support provided by the Christian clinic in launching us for providing us providing us space to share, and other organizations, individuals in the community, and also to Umma Clinic in Los Angeles, Muslim Maryland Clinic in Maryland, and Iman Clinic in Chicago for giving us the feedback and the wherewithal to start this operation. Again, we thank you all and we thank IDF for doing this. Thank you.
I think Dr. Irfan made it very easy for me, so I'll just keep it brief. I just wanted to thank the Illinois Disciples Foundation for helping us change our dream into a reality. Of course, every mission organization starts with a dream, and it starts off as a subconscious thought somewhere in your mind, which some people nurture and make it into a conscious effort, and that's when it becomes a reality. And I commend Dr. Irfan for that, where he had this in the background of his mind, where he had a dream to start this clinic. But the only difference between him and other people was that he turned it into a conscious effort, and he started planning. And once it started, God opens the avenues and doors, and he started talking to other community members, and we all realized that a lot of people were thinking the same way. And I had this in the subconscious mind somewhere too, but maybe I wasn't old enough to bring it forward. And of course, it had such a ripple effect that within months and days, we realized that we had overwhelming responses from our local community. We started getting volunteers from all over our community, the other community members, and before we knew, it had a great ripple effect, and the plan was already there. We started getting overwhelming responses from community health like Champaign County Health Center and Hope Clinic, and they helped us make it again a very, very good reality. And right now, I can only say that our mission is accomplished, and of course, with the help of the Disciples Foundation, we will continue to pursue it even further and make it go very far. And living in Champaign right now, we can raise a toast of champagne and say we did it.
Thank you very much. Our final grantee speaker is Nancy Greenwald. Nancy has been the Executive Director of Smile Healthy for 3.5 years. Prior to that, she worked with Community Shares of Illinois and the Champaign County Healthcare Consumers. Nancy is interested in maximizing health outcomes through responsive community and public health programs. She has served on the Champaign County Board and volunteers for Dr. Howard Elementary School. So please welcome Nancy Greenwald.
Hello. Smile Healthy is a nonprofit organization that provides dental care to the underserved in our community. We have a permanent dental clinic, mobile dental clinics, special events, and coordinate care for thousands of patients each year. We provide direct services and oral health education with the support of area dentists, hygienists, assistants, college students, community volunteers, and donors, and a committed staff. The Illinois Disciples Foundation Social Justice Grants has awarded us $50,000 in a general support grant. It gives us, and I'm very grateful because it gives us tremendous freedom and the ability to make a dramatic impact on the lives of our patients. The grant allows us to provide care to people who might otherwise do without. We usually have to try to schedule our dental clinic days with Medicaid reimbursement in mind or other funders' priorities in mind. This grant allows us and our dental team to add care days based on patient need and allows us to gain experience in serving new populations. Here are just some of a few of the stories we've heard at mobile clinics made possible by the grant from IDF. We had a male patient who received the first teeth cleaning of his life, and he was in his mid-50s. A male patient said that it had been 8 years since he'd been to a dentist and had a tooth broken off at the gum line, causing great pain. We had a young male patient who had been through 8 years of methamphetamine abuse from ages 16 to 24 and needed a full mouth extraction, all 27 teeth. Clean of his addiction and prescription pills and methamphetamines for 53 days when we first saw him. He aspired to become a chef, but felt as though he would not be able to obtain a job due to his appearance at the time and the appearance of his smile. He was very self-conscious of his looks and would love nothing else but to receive full mouth dentures and fulfill his dream of becoming a chef. Smile Healthy helped this patient find, find a dentist who completed his entire treatment and paid for his set of dentures. This man's very grateful. He calls and thanks us and wishes us well quite often. And then just a couple of days ago, we were able to try something else new, adding restorative care clinic events at Lincoln's Challenge Academy. Do y'all know Lincoln's Challenge Academy? Okay. And so we've been going there for a couple of years doing preventive work, doing exams and cleanings, hygiene, fluoride, varnish, sealants. I'm not a dentist, I'm learning all this stuff. But so just on Monday and the week prior, we were there getting cadets restorative care work, like treating, filling cavities and repairing a chipped tooth. And we had 2 boys, cadets, had chipped teeth fixed on Monday, and one had that for 3 years, and his family never got that taken care of. And it was front teeth, and both of these cadets, when they saw what they looked like with their fixed teeth, hugged the dentist, hugged the assistant, hugged everybody in the room. Imagine that. I mean, here they're at Lincoln's Challenge Academy to try to get their lives on track, get their GED and get started. And some of these we're able to now, with support from IDF, to get them started with a bright new smile. The grant also provides us the cash flow, which makes it possible to grow our dental team. It can take a long time to get all the paperwork through Medicaid for reimbursements to start coming each time we add a dentist. The way we work is we don't have like one full-time dentist. We have several part-time dentists who will give us a day a month or a day a week, but we need to be able to bill Medicaid for their care, and that takes forever. So the IDF grant allows us to add a new dentist and start scheduling that dentist right away instead of waiting the 8 weeks it could take to get all the paperwork through and the number from the state. IDF support also allows us to invest in our volunteers and internship program. Smile Healthy will work with over 100 University of Illinois and Parkland College students this year. This has the dual benefit of expanding the amount of care we can provide, since we can count on over 80 hours a week of scheduled volunteer support and of exposing future dentists and dental hygienists to the dramatic need for care. Working with Smile Healthy is the first time many of them learn about what it means to be underserved. We routinely hear, "I had no idea." And that's every student who goes to a clinic event, they say, "I had no idea." Usually I think what they mean is that people don't go to the dentist. Often they ask, why do kids have to go get dental care at school? Or, and we also do this one a lot, "I thought this only happened in other countries, in third world countries." Demand for our program seems to be limitless. I'm afraid we have long waits for care, including one program with a waiting list of over 500 active referrals. We need to do more. The IDF grant has allowed Smile Healthy to participate in community collaborations around delivering dental care to the underserved, including developing programs to serve those who end up in emergency rooms for dental issues, and the community collaboration trying to bring a full-time dental clinic to the Francis Nelson Health Center. Thank you to the IDF board and staff for this generous grant. We will use their support to reach as many as possible and to make an impact on long-term changes.
Thank you very much, Nancy. Before we wrap up the press conference, I have the great pleasure of introducing State Representative Naomi Jacobson. Representative Jacobson was elected to the General Assembly in the fall of 2002. Before that time, she served as Champaign County reporter for 12 years, interim director of a domestic violence shelter, and the executive director of the University YWCA. Jacobson's top priorities as state representative are to increase funding for education, stand up for the University of Illinois, improve access to affordable health care, strengthen environmental standards, fuel our local economy, and be an accessible representative, which I think by being here today, she is definitely doing. So it's my pleasure to introduce our state representative, Naomi Jacobson.
Thank you very much for that kind introduction. It's such a pleasure to be here this morning. All of these agencies, somehow or other, I've had something somewhere in my life that I've either volunteered for, or I've been able to work for, or be in touch with, and more recently, help my constituents sometimes find you. So thank you to the Disciples Foundation, Illinois Disciples Foundation, for making these grants possible. When you decided to do these grants and move in that direction, you could have done other things with that money. And I think this just shows your concern about the people here in Champaign County, so thank you. One of the things I was thinking about, in addition to what you said, what I do, I also chair Human Services, the House Human Services Committee. So it just is so fitting for being able to be invited here today as you award these grants. Thank you. You realize, all of you recipients, it's a great opportunity to get these grants and get recognized, but you know what they're doing for you? They're giving you more work. And I was thinking about that this morning, that's what you're here for. That's why you are in the community the way you are, doing what you are, because you want to serve and you're very willing to take on that additional work. And we probably all have a dream to see, we don't like thinking about losing our jobs, but I've heard Jim Hires with the food pantry, with the Illinois food pantry say, he loves his job, but he almost wished that people didn't need to come to you folks. And as long as we do have these needs, and I'm sure we will have them for a long time, thank you for making the commitment to be able to serve the people that you serve.
Thank you so much. And I would like to thank everyone who spoke today, and all of the grant recipients for all the work that you do in the community, especially in addressing the community issues head-on to create systemic change for social justice. Not just providing services, but working to change the system so we don't have to do that in the future. The issues addressed by our grant recipients are not unique to Champaign County necessarily. They're a part of a national and international situations. But we can be most effective in creating a wider systemic, institutional, and societal change by struggling for justice here at home, in our community. And this is a favorite quote of mine. Martin Luther King Jr. once stated, "Human progress is neither automatic nor inevitable. Every step toward the goal of justice requires sacrifice, suffering, and struggle. The tireless exertions and passionate concern of dedicated individuals." And I believe that this year's grant recipients exemplify the struggles they spoke of. And with the IDF social justice grants, we strive for more than just reading grant applications and signing checks and being hands-off. We see this as an opportunity to build connections and resources amongst the grant recipients, to bring awareness to issues facing our community, and to join together in solidarity to seek systemic change that will bring peace and social justice to Champaign County. Lastly, I would like to call on the members of our community to get involved. There are so many ways that we can all make a difference. I know many of you here are already overstressed in what you do and are doing so much. But to anyone else, please get involved. If you have time and passion, become a volunteer for one of the grant organizations. Many of them are dependent on their volunteers and can always use more help. You can also make an impact through donations, either directly to a grant recipient or to an organization like Community Shares of Illinois. Feel free to visit the IDF website to get links to the websites of all the grantee organizations. That way you can check them out online, get information, and get in contact with them so you can make a difference and be part of the struggle. In a moment, we will conclude the press conference portion of today's event and move into the grantee meet and greet, which is basically an informal chance for you guys just to get to know each other. I know a lot of times we'll recognize names that we've been on email so many times and have never met in person. So take a chance to get some snacks, beverages, share literature, and make some connections. Feel free to, if you have any questions for the IDF staff and board, please let us know. But before we do that, I would like to thank everyone for coming out. And the most important, or one of my favorite parts of this event is having all the grant recipients come up to the front so we can take a group picture. I think that really shows the strength of the social justice work in our community. So at this time, if representatives from the grantee organizations would come up, and we will take a photo.